Well, let's talk about one very vital sector in the life of the nation. That's the medical sector. I mean, we can't do without health and the health and medical workers. But it looks like there's some trouble brewing in the medical sector if the right things are not done. Now, we're joined on the program by the president of the Nigerian Medical Association, Professor Bala Audu, joins us virtually on the program this morning. Professor Audu, good morning and welcome to the program.
Good morning. Hi, thank you for having me.
It's good to have you.
Good morning, viewers.
It's been 1 year, thereabouts, of your tenure. And well, so far, so good, some would say. But it looks like there's a major issue coming up now. You've had to give the federal government a 21-day ultimatum. Else, there will be disruption of services. Now, this concerns the National Salaries, Income and Wages Commission. Circular was put out, but it's not sitting down well with you. We do not want any industrial action on our hands because, I mean, we have a lot to deal with already. But maybe some background for people who do not understand what exactly is at play here and what is at stake. So maybe you can provide that clarification. Why the 21-day ultimatum?
Basically, the Nigerian Medical Association has come in with a very good strategy for advocacy for all issues around the health sector, particularly to improve the quality of healthcare to all Nigerians and make it more accessible. And throughout our tenure, we have been principal advocates of these issues. In addition, it is very critical also to understand that healthcare delivery is manpower intensive. It is physician driven. And therefore, the health workforce needs to be taken care of to enable it to rededicate itself to delivering quality healthcare to Nigerians. Over this 1 year, we've had reasons to do various advocacies at various levels with government, at federal, state, and even at local government level. And our advocacy is mainly to push for the retention of the health workforce to deliver quality, best care practices of medicine and all healthcare components to Nigerians. However, we had a number of challenges for which we still went on to advocacy, lobbying, so that we are able to provide Nigeria's health sector with that stability that is critical to improve our health population indices. Along with this, government, particularly in the Federal Ministry of Health, were also quite cooperative with us in ensuring that this stability is preserved. And this very rigid stability between all health sector workers and the Federal Ministry of Health was actually yielding very positive results with very good policies coming out from the federal government through the Federal Ministry of Health. Amongst the challenges we had been playing advocacy for instance, is the arrears on the 25%, 30% increase in the consolidated medical salary structure, which has been approved by Mr. President, and the implementation started in January 2003, 2004, but there was a 7 months arrears. For the last 18 months, we have been very patient across the medical profession, across all healthcare providers, playing advocacy and being patient to ensure that government delivers on its promises. While this was going on, the consequential adjustment on salaries came, including the consequential adjustment on the consolidated medical salary structure. When the National Wages, Incomes and Salaries Commission brought out its circular indicating the consequential adjustment on the consolidated medical salary structure, the Nigerian Medical Association noticed that the commission did not apply certain CBA agreements, central collective bargaining agreements of 2001, 2009, and 2014 on the allowances, because these allowances are a product of a percentage of the basic salary. However, this was not applied. In line with our principles of advocacy, we wrote to the Commission through the Ministry of Health, calling their attention to make this correction. We kept playing advocacy, going from pillar to post to ensure that these issues are addressed. However, by the first of this month, a circular was issued by the National Salaries, Incomes and Wages Commission. This circular was issued unilaterally, and it completely ignored the observations that were raised. In fact, it even refused to involve the Federal Ministry of Health in developing this circular. There were no inputs or dialogues with us who presented the complaints to them, so that if there are any issues to negotiate, we could have mutually negotiated them. But beyond that, the circular did two very critical, unacceptable things. The first it did was to erode the already existing relativity between the pay packages across the health professions. In addition, it introduced new allowances partially to different aspects and different sectors of the health workforce with negotiation, without any discussion. And in so doing, it further eroded the existing relativity to the disadvantage of the medical professionals. Having done that, it did not stop there. The circular actually went ahead to reduce some of the allowances of the very senior consultants, whom we know many are already leaving this country.
All right.
And we have a situation where we have great challenges with the health workforce, particularly at the very senior medical level, but also at other levels. This is the key issue that has to do with the circular from the National Salaries, Incomes and Wages Commission. In addition to other issues that we raise that are pending.
Yeah, your explanation is quite, telling, and it's disappointing as well, particularly when you cite 2001 and 2009 agreements. One would have thought that the relative stability experienced in the medical health sector in the last couple of years is, due to some form of agreements being reached and these issues being addressed between government and the union. And you have also, in fact, said that there was no discussion. Now, since the issuing of your 21-day ultimatum, to government to resolve these issues identified in the circular released by the National Salaries and Wages Commission, has there been any engagement, deliberate engagement from the Ministry of Health to the NMA or relevant, health unions to try to resolve these issues?
Yes, we have had relevant engagements. We have not had one yet from the Federal Ministry of Health, at least not at their own direct invitation, even though we have had a direct engagement with the Minister of State for Health, Dr. Salako, and the engagement was mutually respectful, beneficial, and it points to a direction that we are likely to have solutions before the end of the ultimatum. Tomorrow, we have another engagement with the Honorable Coordinating Minister of Health and Social Welfare. Earlier on, we have also had engagement with the Department of State Security, who have tried to meticulously and very professionally identify where the key infractions are, with the sole focus and target of ensuring that stability within the health sector is ensured, with the sole focus of ensuring that all the legitimate demands that we have requested for are fulfilled, and critically also to ensure that any industrial disharmony is resolved and stability is maintained, not just within the health sector, but nationally as well.
So in your view, what can further help, not because the issues about industrial action is not novel to our environment, it's happened, but ours is quite repetitive when it comes to essential service, and we're happy that it slowed down a bit. What can be done to further ensure that we don't even have to come to a table to begin to talk about averting crisis, such as downing tools by essential workers like yours and your colleague?
Our demands are very simple, they are very straightforward. We don't have a single demand that is new. All our demands are already approved demands. The only demand that is unilateral is the product of the circular by the National Salaries, Wages and Incomes Commission. And our simple demand is that the circular from the National Salaries, Incomes and Wages Commission should first and foremost be withdrawn, so that all stakeholders can come to the negotiating table and discuss. Our second demand is to ensure all the arrears that have accrued over the last 18 months are also settled immediately. That is also not far-fetched, because the President and Commander-in-Chief of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, has actually given an approval for the payment of those allowances. And we wonder really who along the line is refusing to implement. Our other demand is to set up a collective bargaining agreement process, which has been due for review for over the last 10 years. All these are processes that are very easy to comply with. While we are talking about retaining the health workforce, while we are talking about doubling the carrying capacity for our health institutions to produce more healthcare professionals, particularly doctors, dentists, nurses, in order to replace our dwindling population of healthcare workers as a result of the Tapa syndrome, the demand on the healthcare workforce is to such an extent that each and every day we have burnout, which makes delivery of healthcare very difficult. And all we are asking for is a collective bargaining agreement that will address some of these critical issues. And we don't think what we are asking for is too much. But while that is going on, very good measures were taken by the federal government, but we await implementation. And this includes increasing the retirement age for critical healthcare workers who are involved in direct care of patients to 70 years of age. But this is yet to be implemented because it is still awaiting the National Council of Establishment's approval. But we strongly believe that since Mr. President has already given this approval, an anticipated approval can be given before the National Council of Establishment meets, because it has not met for ages.
So two things now, as we begin to wind down. On the one hand, who is meant to make the decision? On whose table does this approval, or is this approval pending? So we're able to isolate it. Is it the Salaries, Incomes, and Wages Commission? Is it the Ministry of Health? Is it the Ministry of Finance? On the one hand. Secondly, where are we now on this 21-day ultimatum? Are we at day 5, day 6? And if your demands are not met, what do we risk happening here? So 3 questions in one. Is kind of a bumper package, but I trust you can handle that.
Yeah, depending on the component we're looking at, the setting up of the CBA is domiciled in the Ministry of Health. The withdrawal and correction of the circular is domiciled with the National Salaries, Incomes, and Wages Commission. And also the immediate withdrawal of the obnoxious circular is also domiciled with them. If they had done that, because today we are at about 14 days and 10 days into our ultimatum. If they had done that, you could have said maybe 30% of the problem is solved. And it is also their responsibility to engage stakeholders to resolve the issues that were raised. The issues of all the areas that have been processed and approved is domiciled directly on the desk of the Minister of Finance. All the other issues, all the other remaining issues, like the retirement age, the formation of the boards, and so on and so forth, domiciled in the Ministry of Health, because the Ministry of Health has the prerogative to request the National Council of Establishment to give an accelerated approval. It also has the mandate to reconstitute the boards, and so on and so forth. So
what's at stake here? What do we risk having on our hands if it's not met in 11 days now, because we're at day 10?
What is at stake is that we risk the whole healthcare system of this country being shut down, which the Nigeria Medical Association does not in any way want to see that happen. And the Nigeria Medical Association, and indeed every Nigerian doctor, is working to ensure that that does not happen, as long as government is responsive. And it has clearly been shown that each and every component of our request is something, in fact, all our components are low-hanging fruits. In fact, none of these components needed to have come to the public at all.
And there are other issues, Professor Audu. There are some policies of government on health workforce retention, increase in age, retirement, and you can also talk about, increase in recruitment that your sister agency was, advocating for in 2023 ahead of the coming of this administration. How far with the implementation of these issues, because they're critical to the stability of the health sector? What is the Ministry of Health, in line with the Ministry of Finance, saying about these, the implementation of these issues?
This is where the NMA has been very great advocates. You see, with the Japa syndrome, we're losing very critical health workforce. In addition, we are doubling the carrying capacity of our tertiary institutions to train more healthcare providers. All this has put a great strain on those of us who have been patriotic to remain home in order to have these problems and challenges addressed. Now, the policies are in place. The president has given a waiver to the health sector to recruit the critical clinical workforce that will ensure that best quality health care that is patient-centered and respectable is provided to all Nigerians. However, that policy is not being fully implemented because the health institutions that should do the recruitment have not received these waivers from which they have been exempted. So this is a responsibility between the Federal Ministry of Health and each tertiary health institution. Now, if the boards of the tertiary health institutions were in place, then it would simply have been a function of the board and each tertiary health institution, and all these problems would have been significantly solved. In addition, the budgeting is also critical to ensure that the additional manpower required is catered for, and also to ensure that more young doctors go into the residency training program, so that down the line, as the years go down, we are not hit by even a worse situation. Because what we have at the moment is a situation where less and less number of young medical graduates are going for postgraduate medical training in order to become specialists. Most of them are opting out to go to other parts of the world to receive this training. And they represent one of the most critical workforce that makes our hospitals function. But you must also provide for funding for that. Very good. The government has provided the medical residency training fund, but the implementation is rather very, very poor, in the sense that, yes, while the funds get released, but often they get released after they are needed. They are not released at the critical time when these postgraduate medical professionals require it to do what is critical for them to advance in their training progress, specialize time, and take the responsibility of delivering high-quality care to Nigerians. And it is amongst the issues that we have raised. And government is in a very good position to be able to solve it without any challenge. It is just a simple matter of commitment. Nigerian doctors have been committed, continue to be recommitted and dedicated to providing quality healthcare for all Nigerians. And we have been doing advocacy for this. However, who is doing advocacy for Nigerian doctors to be able to deliver the responsibilities that have been bestowed upon them? For example,
Prof, just a very quick follow-up. Prof. Can you tell us if the budgeting for the recruitment of you know, additional workforce to augment what currently obtains in the health sector, either, well, at the federal level, was it prioritized in the 2025 budget or in the 2024 budget? Was it prioritized?
Yes, we believe it's prioritized, but more than just that. Remember, most of what we are talking about is not even a new health workforce. What we are talking about is replacing those that have left. So there are enough vacancies. The fund is already there. In fact, I believe the funds are not even adequately utilized.
Whew. Professor Audu, we could have this conversation all day because it's an important one.
Yes, I guess you understand what I mean.
Oh, absolutely.
If you have a hospital where 10 consultants have left, 20 resident doctors have left, and you have not replaced them, and you already have their salaries in your budget, all you need to, you don't need any additional salary. All you need to do is to replace them.
And that's a fair point, Professor Audu. Just final note. It's a very important conversation. Can you paint a picture of just how much deficiency we have in terms of manpower in Nigeria's health sector? If you have a percentage or on a scale of 1 to 10, just how deficient are we, particularly with doctors now, when it comes to manpower in Nigeria?
It's very difficult to get reliable data, as you know, but the Medical and Dental Consultants Association have very robust data that has indicated that up to 30% of our consultant workforce has been depleted.
Cool. At
a time that our population is increasing, the demand for services are increasing. There is a need to train more and more people. In the same vein, the registration for postgraduate examination and the uptake of new young medical professionals who should go into training, specialize, and take up the positions of consultants that are either leaving the country, going into retirement, or who are just even leaving healthcare delivery to go and do other things, has also fallen by at least 40%.
Oof. I mean, those are very huge numbers. And I really hope that the government and those in the position take this with every sense of seriousness and urgency. 11 days to go on that your ultimatum. We do not want to see any form of disruption. But we have to thank you so much for your time, your service. We've been speaking with the president of the Nigerian Medical Association, Professor Bala Audu. We wish and hope that these issues are resolved. Thank you for your time.
Thank you very much. I'm sure with engagement like this, and with you also engaging the relevant stakeholders, we'll be able to resolve this problem in the very short time.
Certainly. Thank you so much for your time. I mean, there's no option we have. We have to fix that sector. So 11 days to go. The NMA has given that ultimatum, and we do not want to see any further disruption to the health sector. But